Esther, we know that there's a lot of people now having diabetes, and it's very dangerous. And I want to know, what is actually diabetes?
So diabetes is a condition where the body cannot maintain healthy levels of glucose or sugar in the body. What happens in diabetes is that blood sugar levels become high as a result of an inability of the body to either produce enough insulin, or the body cannot respond appropriately to the insulin that is being produced, and therefore then blood glucose levels rise.
Okay, I know there is a type 1, type 2 diabetes. What's the difference between the type 1 and type 2 diabetes?
Okay, so type 1 diabetes is actually what we call an insulin deficient state. So in type 1 diabetes, the body is not producing enough insulin, or is producing little to almost no insulin. And because of that, blood glucose levels rise. In type 2 diabetes, on the other hand, is actually a condition of insulin resistance. So the body is producing insulin, but the cells are unable to respond appropriately to the level of insulin that is being produced.
Does the symptoms in the patient difference from type 1 and type 2?
No, not really. So when high blood glucose is present, patients will experience symptoms like they may feel more thirsty, they may feel like they need to pass more urine, so increased frequency of urination. They may have an increased risk of infections, so things like vaginal infections, urinary tract infections, skin infections are quite common as well. Other common symptoms of diabetes include feeling very tired, sometimes even blurring of vision.
So how do you actually decide, oh okay, this one is type 1, this one is type 2? Does it shows in our blood test?
So in type 1 diabetes, because patients do not have insulin production, they tend to present very acutely, means in a short period of time. They will have symptoms, perhaps maybe a few days to a week or so, and then because their blood glucose levels become high and they do not have any insulin production, they actually experience a diabetes emergency called diabetic ketoacidosis, or DKA. And a lot of patients actually will seek medical attention and are usually admitted at that point of diagnosis.
So they will feel fainted, or
yeah, they may have very severe symptoms, and there is the risk of let's say losing consciousness.
I see. And then for type 2?
In type 2 diabetes, they usually present over a longer period of time, because here the body is still producing insulin, but just that the blood glucose level is higher than it should be. So they will have symptoms of the increased thirst, passing a lot more urine, sometimes even a bit of weight loss, but they can present perhaps sometimes weeks or even months later.
I see.
Yeah.
And I'm sure the treatment will be different too from type 1 and type 2, right?
Yes, that's right.
So what would you recommend patients for the treatment?
So for type 1 diabetes, patients are dependent on insulin injections. Insulin is needed for life. In type 2 diabetes, depending on the level of blood glucose elevation, we can treat with lifestyle management first, and then progressing on to oral medications, and sometimes insulin injections are also needed.
Okay. So how does our lifestyle actually plays a part in managing the diabetes?
That's a very good question. So lifestyle management is actually the foundation of how we manage diabetes. And lifestyle management here includes nutrition, medical nutrition therapy, as well as physical activity. So in the nutrition part of it, we always advocate eating a very healthy diet, everything in moderation. There is something called the healthy plate concept,
Yes.
where you fill half the plate with vegetables and fruits, and then a quarter of the plate with healthy whole grain carbohydrates, and then the other quarter with protein. Yeah, we also emphasize on drinking water as your beverage of choice and avoiding sugar sweetened beverages. And as you know, carbohydrates come in the form of, let's say, rice, noodles, pasta, potatoes, even hidden in corn, in many different things. Even milk has a level of carbohydrates in it. So the point is that we are trying to promote healthier carbohydrates, so carbohydrates that are sort of whole grain and of lower glycemic index, and to control the portion of the carbohydrates.
If you eat all the grains, the complex carbohydrate,
Yes.
will the body will able to process it, or?
Yes, so how complex carbohydrates are better for the body as compared to refined carbohydrates is that when it is consumed, the glucose is released in a slower manner. So there isn't that spike of blood glucose that you may see when you consume refined carbohydrates or even sugary drinks.
Okay.
So that's actually better for the body.
Okay. Thank you so much, Dr. Esther,
Okay.
for your time and for the information.